everyone. Thanks for coming. I know it's been a great but a long day, and as we go through the last presentation, I appreciate you being here. I was thrilled to be in your seat last night, and I just wanted to share a little bit with our experiences of incorporating a pro bono clinic throughout PT curriculum at an urban university. I'm at Wayne State University in Detroit, Michigan. And so really what I want to do is just let you know how we've incorporated, how and why. All right, look at how we've brought in student and community engagement opportunities and strategies, and then look at the challenges and some of the lessons that we've actually learned as we went through. I put up these next few slides, not so that you read all the words, but just that you get a sense. The clinic at our university was started as a college initiative. And when we look at the mission, and you kind of see in red, looking at advancing the health and well-being of society, and then when we look at our values and our goals, that you'll see that the idea of being responsive to the needs of the communities and enhancing the service to our communities comes out to be pretty clear. And then that was our code. And then when you look at our Department of Healthcare Sciences, again, through the strategic planning, looking at how service is important to the community and to the university, and that some of the things that we wanted to do was to increase the types and quality of community engagement that existed, and looking at how we could increase community engagement throughout our department. And then it went right back down to our PT program as well. And we really wanted to increase our faculty, student, and alumni involvement in our community activities. So you can see that throughout the mission of our university, that it's quite clear. Service is an important component. Also, when we look professionally at the APTA, looking at our core values, one of the 7 is social responsibility, how that we really should, as PTs, take and participate in efforts to meet the health needs of people that are local. And that's where our university kind of pulled to that. And then looking at how pro bono services really is a component of that. All right? And so I think you can see that the driving force throughout the university was this service mission, but also that as professionals, that we have this professional responsibility as well. Okay? Just so you have a little bit of information regarding our program specifically, ours is a 3.5-year DPT program. All right? Our clinical education, we have 2 part-time integrated experiences, and then 4 full-time clinical experiences, 2 of which are 2 6 weeks at the end of the 2nd year, and then 2 culminating 14-week internships at the end of the academic curriculum. Okay? So in total, they have 40 weeks of full-time clinicals. Okay? Now, when you look at my role, I'm the Director of Clinical Education. All right, my primary responsibility is the clinical education component of the program. So I do all the teaching and the administrative component for the clinical education, probably just like all of you have a DC at your university, right? But that as a faculty, I have other responsibilities, including scholarship and service. And the service includes committee work, community engagement, and it became part of the development of our pro bono clinics. Okay? So, important when you kind of say, how did we get this all started and why? We had to start with the community engagement initially. And so as we started looking back at what we were going to be doing, this community engagement is where we started a partnership with our university and the State Detroit Family Health Center, which is a component of the Detroit Rescue Mission Ministries. All right? This Family Health Center was established in 2008 by Mitch Album and the State Detroit. The medical director is Dr. Peggy Richardson, and she came to our university and gave a lecture. And it was a very inspirational lecture of the idea of us and the need as clinicians, students, faculty to give back. This clinic specifically provides care to women and families who are uninsured or underinsured. So they already had a going clinic that was in process, right? They provided maintenance and preventative health care, and all the diagnostics and treatment and education was incorporated as part of that clinic. And so when we looked at community engagement in order to think about starting a pro bono clinic, we had to involve not just our community partner of the State Detroit Clinic, but then to look at how were we going to run it, okay? And so we had to look at healthcare practitioners in our community. We looked at the alumni. We then looked at corporate partnerships and individual partners. And that's where our first clinic, and I'll have 2 that I'll talk about, was a diabetes education and wellness clinic. This is an interprofessional, student-run clinic with faculty faculty, and clinical community mentors. And so it's consisted initially of 5 disciplines: pharmacy, PT/OT, social work, and nutrition or dietetics. Okay? And then more recently, we've added medical students. And so we started this clinic in 2011, and it's run twice a month on the first and the third Monday of each month. Okay? Out of this clinic, okay, grew what we had. This is just a few pictures just to give you a little break in the slides. Out of the diabetes clinic grew the physical therapy clinic. We were there as part of the 5 disciplines, and the medical clinic was going on down the hall. And what they would say is, oh, hey, I have a patient that needs physical therapy. Can you see them? Okay? So that there became a need that was evident and one that we could actually fulfill. And that's how our physical therapy clinic came to be. Initially, we were run just on the same nights as our diabetes clinic. And then in 2012, we did it every Monday. And then in 2013, this past year, we did it twice a week on Mondays and Wednesdays, 3 hours a clinic. Okay? This is to give you a little bit of a link. Hopefully, it will give you a little bit of a...
When I say Xerox, chances are you don't think of insurance claims, as in the 900 million health insurance claims to be processed.
We'll do that. This is not a professional video, but it just gives you a sense of the people who are involved. This is the building that we're in, and it's in Detroit in Highland Park. No lighting on the street. Wayne State University has established a community partnership with the Save Detroit Family Health Center. As part of this initiative, we provide pro bono physical therapy services 2 days a week and a diabetes education and wellness clinic, otherwise known as the DO, 2 days a month. The PT and DO clinics exist because of the many, many volunteers that make them happen. The students, professional community mentors and clinicians, faculty, and donors. We all come together to bring these services to our clients. Now, let's hear from some others that make it happen.
I'd just like to say that it's just been a pleasure having physical therapy available here at the State Clinic. Physical therapy from Wayne State has been available here for 2 years, and I cannot express enough how much of a benefit it is to just have it right down the hall for our patients to be able to get treated.
So we're down the hall from
the reason I come, I keep doing it.
One of our PTs from
it is to see some of those chronic conditions because they are really challenging. I'm actually more focused on a neuro population, so keeping my skills up on an orthopedic basis is really important to me as well. And I also get to teach. There's a lot of students that come in from Wayne State, third-year students.
So our clinical instructors come
and I think it kind of gives them
areas, not all from the same university, and definitely not on our
work on their skills as well,
but
and
they're
the way
for
they're
clinical
not
faculty
graded and things
and
like
adjunct
that.
faculty.
And they can also see what happens if these common ailments aren't treated right away. And it gives them a sense that they need to be giving back themselves when they become therapists.
So he was a neurotherapist.
In all the different professions involved in the clinic,
She's an
I
alumni.
really appreciate each other and their contributions to a holistic management of the patients with diabetes. And I think that's another very important aspect.
This is our OT team, motor station.
This clinic, what it provides for our students, is very unique.
We're at the State Clinic today as part of our second year curriculum.
Here at the SAVE, we work with underinsured or uninsured individuals of Detroit. We get the experience to practice what we're learning in class, and we work with classmates above and below us. We work with volunteer professionals and some of our faculty. So it's a really good experience to get some practical education. We get to practice what we learn. We get to see what other people think. We get to learn new things. So overall, it's been a really rewarding thing that we get the opportunity to do here at SAVE.
So they are
I was first exposed to the State Detroit Clinic and the Duke Clinic my first year as a first-year student, and that was a requirement for our class. And it was a really great experience, so I decided to continue and volunteer, and now I'm a third-year student volunteering at the Detroit State Clinic. Also a great thing because when you go into Wayne State, one of the things they really focus on is service to the community.
Our volunteers gain so much from being at the clinic, but so do our patients. Let's hear from them.
Physical therapy has been very helpful to me since I've started. This is my second session, And my first session, I completely could not walk. My hip was hurting me, giving me so much trouble. And with Martha's help and working out and the exercises and the stretches and the techniques of walking better and everything's been really helpful. And I actually haven't had pain since my last session, so I'm really happy about that.
I came to the clinic for physical therapy. My muscles, I've always been thin. I never thought I had issues with my muscles. I was having certain problems, and they gave me different exercises to do. The exercises were wonderful. The people were wonderful. They were very encouraging. I couldn't do the exercises at first. They were very patient and showed me time and time again the correct way to do them. I still continue the exercises at home. It has improved things for myself greatly.
Opportunities exist for clinical research with our clients and our students at the Sage Detroit Clinic. Other opportunities for student leadership are available, including the DO Interdisciplinary Student Board and the PT Clinic Student Leadership Committee. They wanted to be here today. In closing, thank you to everyone involved in the ongoing development of the DO and PT clinics at the Sage Detroit Family Health Center. All right, so you get a sense. Okay, now let me see if I can go back. Down at the bottom. Okay, so that just gives you an idea of a little bit of the people that are involved in the clinic. So you can see that our program starts with mandatory site visits to the clinic, unlike some of the other ones where it's all voluntary. But that there are opportunities for leadership, volunteering, service learning, and research throughout. And you know what, I see this story. Go it wrong way. No. Yeah. Sorry. Fix one up. There we go. Okay, so when you look at our curriculum, in the first year through the course, and because I'm the director of ClinEd and actually organize the integrated clinicals, we have students required visits in the first and second year and in the third year, so that they are actually in the clinic at least once or twice every single year, and then additional opportunities for volunteering. In the first year, they go out in the spring of their first year, and it's an opportunity for them to demonstrate professional behaviors, basic skills, looking at documentation. They do have to write a daily note, and they get exposure to the paper and electronic version of home exercises. Okay? The second years, in the fall of their second year program, they go to our diabetes clinic, and this is where they do 2 separate visits. Their first visit is an interprofessional team visit, where they actually go to each of the 5 disciplines and learn what their role is in educating a patient with diabetes. And so, as part of that, they also go to the PT station, which includes exercise and foot care. And all students are exposed to clinical research at the clinic visit and what we're actually doing. On the second visit, that's where the students then, based on the first visit, are prepared and know that they need to provide the PT education under the supervision of a physical therapist regarding foot care and exercise. And the patients are scheduled to come in for 4 visits, so there's something scheduled for visit 1, 2, 3, and 4 that they actually provide. As part of this, the students also learn goal setting before, and they all do a reflection after. Okay? They also do, in the second year, a visit at the PT clinic. Again, this is where now we actually have a PY3, a third year, teamed with a PY2, and then together they perform the subjective and objective evaluations under the supervision of a clinical instructor, do the interventions, discuss it, provide the documentation, and the education. So that's where they're putting it all together. Okay? Just a few other pictures. And then in the third year, our students, before they go out on their final internships, work with the faculty in the clinical decision-making course. And this is where the students are in teams of 3, and they work with 1 patient, 1 faculty oversight, and they actually do that entire treatment. So that the faculty who's teaching that course feels that the students are ready to go for their full-time internships and that they can pull everything together in working with a patient and providing the subjective, the objective examination, the treatment, documentation, coming up with a plan of care and what they're going to be doing. Okay. And this is just one of our faculty members, and you can see kind of doing a little bit of teaching as she goes. So the student engagement also involves looking at leadership opportunities that exist. And similar to many of the universities here, we do have a Say Detroit PT Student Leadership Committee, where we have 5 coordinator roles with each of the class, the third years and the second years, and we're soon to be adding the first years. Okay? But we also have the DO, or the Diabetes Interdisciplinary Student Board, where we have representatives from each of the disciplines. So there are 2 very separate and distinct leadership groups that work and coordinate together to provide the services that we need. Okay? There also is opportunity for volunteerism and service. All of the students, once they've done the mandatory clinicals, then they're able to come in at any point and to sign up to volunteer. Okay? And we also have pre-PT students that are part of the PT clinic. There's 2 that are assigned every single clinic visit day, and they help more with the looking at the reception part of it, the charts, the pulling out, the tech duties, cleaning out, that kind of thing. We also have service learning opportunities within the class, diversity in healthcare, and it's one of many projects that a student could use. I think the other thing that I just really wanted to bring up is the research component, that when we're looking at the student groups, that there is a ongoing interdisciplinary research project at the diabetes clinic, but that the physical therapy students can choose to do their research as part of their 2-year project that they do within the PT curriculum. And every year we have groups of 2 to 5 students, at least 1 or 2 of them within the clinic doing their research. And the latest one is looking at health behaviors and blood pressures in the clinic. All right. So on a typical, I just really wanted to give you a little bit, looking at our patients, often multiple diagnoses, similar to the very common patients that we've talked about today, chronic conditions, comorbidities. We have faculty, usually 1 to 2 PTs at each clinic and 1 faculty oversight. And the students, we always typically have, depending on the time of year, 1 to 2 first-year students, 1 to 2 second-year students, and at least 1 third-year student, and then 1 to 2 pre-PT students. So it just gives you a sense of the clinic. Some of the outcomes that we're looking at, the number of patient visits, the satisfaction surveys, and the list goes on. You can kind of read through it. But I think some of the challenges I just wanted to discuss with you has certainly been our consistency in patient attendance, and I think that hasn't been a surprising thing. Our number of cancels, no-shows has been relatively high, 35%, sometimes even as high as 40%. Due to transportation, many of our patients do take a bus. They have to walk down the street. The street has no lights, believe it or not. That's downtown Detroit, or Highland Park. And so at night, it's a problem. Anyways, the weather, the snow, certainly this year has been a good example. Scheduling has definitely been an issue. How many patients to schedule for the number of patients and for the number of PTs? That definitely has required a little flexibility, and flexibility on the part of the CI being there if the patient doesn't show up, and how they can work constructively with that time. Some of the building issues, heat, lack of heat. So we have fans. We have had to cancel on occasion, lighting on the street, parking. So there have been some issues. But we do have a confined lot that has worked out well. Okay. Some of the patient continuity of care, we do have therapists that are scheduled, but it's not the same therapist every night. Many therapists come once a month. So it's different therapists, oftentimes. The documentation has been a little bit of an issue. It's all been handwritten up to this point. We are going to RepPT, an electronic medical record, getting the training in April. So that's actually been one of our challenges that we're hoping to overcome. The training and orienting of new volunteers and the transition between groups of students has been an issue. Certainly the coverage during exams, breaks, and summer has always been an issue. Although we have run the clinic the past 2 summers, and although it's been at a decreased number of students, we've always been able to cover, which has been great. Our students are on their clinicals during the summer. Second and third year students are out on their full-time clinicals. Okay. So looking forward, certainly we definitely want to continue both clinics. We need to recruit more faculty. We want to continue the student leadership groups that we have, adding electronic documentation and an advisory board. That's something that we haven't done across the board as of yet, and we want to do that. That would include patients, faculty, and a group of people to look at giving us advice. Looking at ongoing training for the students and faculty is something that we definitely need to be doing. We want to grow the scholarly research agenda and to be able to disseminate that and expand our funding base. So some of the key lessons learned that we definitely need commitment. Commitment from the students, administration, the faculty, our clinical community. We want to develop and cultivate those partnerships, and it is an ongoing process, not something you just do at the beginning. But I always say you want to start. You want to start. I say initially, nothing's going to be perfect, but just starting it. I think incorporating the clinic into my role as a director of Clin Ed worked well for us, but I think it's a work in progress. You want to begin simple, start with one clinic, one Clin Ed experience, expand as your resources allow. You want to maximize on the strengths of the participants, plan the utilization of all your resources so that you can maximize the time, the energy, and the resources that you have. And I think the big thing is to have this ongoing reevaluation that you're doing, revising your clinic, the goals as it's going, and as you're seeing things happening day in and day out, what's working, what isn't working, and I think re-energizing. And I think this has been a really nice way to kind of get some of that energy that you feel from other clinics. Every year that I've come, I've taken away ideas to go back. And so I think that's what you need when you're working with a pro bono clinic. You need that maximum energy so that we can go back and do what we do best in providing a service to our patients. Anyways, I'm happy to take questions if anybody has any. Yeah.
In the beginning, you have these integrated clinicals, and I assume they're not every day, it's once a week. How often is that?
They're Tuesdays and Thursday mornings from 8 until 12. So that's part of where they're actually going out into a clinic, and then as part of that, they are doing 1 or 2 visits at our clinic. So in the evening. So we've scheduled and we've made sure that the schedule is such that they're able to go.
And where they're going out, is it clinics like a diabetes clinic, those kinds of clinics?
It could be anything. It could be anything.
Okay.
It could be anything.
Because I guess I'm always concerned, and this has come up, I think, before in these conversations about continuity of care from the physical therapy perspective, the student perspective.
Yeah.
You come into the clinic once every 3 weeks or so, and you see a different patient. You never get to see what's happening with that patient. You never develop that relationship.
And I think with the integrated clinicals, that patient continuity is not the same goal as it is for our full-time clinicals, where you need to see that continuity of care. So with each clinical experience, they have specific things that they need to do. It's almost like a checkoff list. So for the patients, I think sometimes that patient continuity could be a little bit better. But for the students, I think any patient experience at that point in their career, academic career, is very helpful. So I don't see it so much from the student perspective, but I do see it sometimes from the patient perspective. And I think that is an issue that we need to keep working on. Yeah.
All right. That's all the time we have for questions right now. If we all make our way back into the other room, I think we're